Hi everybody, I'm Dr. Boz. Welcome back, and I have a great show for you tonight. These slides I've been working on for a few weeks, and even though that's been a little interrupted, I think you're really going to like the message. The overall theme of why I chose this topic and why many of the topics end up on the channel is because you wrote in. Many people ask about the struggles they have when eating a high-fat diet, and especially when they first transition to a high-fat diet. And it wasn't just a couple of you, it's been probably a couple hundred of you that have asked what it is I do when patients show up in the clinic and they have this same problem. So the answer isn't quick and easy. You can't get it in a few letters. So I put together this slide deck to really explain why I tell patients to lick the spoon. You'll know what that means more by the end of this. All right, let's head over and we will get started on, let's see here. We are going to talk about triglycerides. So as I look at the punchline for talking about triglycerides, the first thing I want you to put in your head is every time you hear that word triglyceride, I want you to think of fat, specifically 3 strings of fat. So that's what the tri stands for at the beginning of that Latin word. And when I'm drawing out the characters for this, I used 3 ropes. And the links of these ropes are going to be important as we go through this, but we're going to tie these 3 ropes together, or these 3 strings of fat together, with a really sticky, sugar-like substance called glycerol. So glycerol plus 3 fat chains are called triglycerides. But not all triglycerides are made the same. And the triglyceride length is divided into whether those ropes are short, medium, or long chains. And the properties of these chains are very different and come into play very importantly when I'm taking care of patients. So for short chains, this is really actually pretty easy how we came up with this, or how they were first divided. And that is that a short chain only has 4 or 6 carbons in its length. So when I'm drawing it, I just put much shorter ropes on the triglycerides there. You'll also see in the chemical structures here that the carbons are what we're counting. So those dark gray circles in the center of those structures below show that the smallest triglycerides are 4 carbons long. The next length of chain is a C6, which is 6 carbons long. When you're looking at the taste of C4 and C6 in either supplements or in the fats that we eat, they're really bitter and acidic. So you don't find them very much in commercial foods or in any of our recipes of most fats because of how terrible they taste. Next, we move to Goldilocks number 2, medium chain triglycerides. And these carbon links are 8 or 10 links long. You'll find medium chain triglycerides in coconut products. You'll also find it in breast milk. You'll find it in lots of goat products. They do take a little bit of effort to get them tasting good as well as purified. Most of the fats that you see in our diet are actually long chain triglycerides or long chain fats. And we start counting that at 12 and we take it all the way up to 20. I have a couple of much more thorough videos than this that go through why it is that coconuts really had a much better marketing team, because they are often marketed as these medium chain triglycerides, when most of coconuts have between 75 and 80% of their fats are these long chain or 12 carbons long. And by the end of this slide deck, you're going to understand why that's so important. So as we look at these medium chain triglycerides, specifically when I say that, triglycerides are the fats and the medium means they're C8 or C10. Whenever you're seeing me talk about or educate or write about these medium chain triglycerides, I am really specific about saying I'm talking about C8 and C10. So these medium chain triglycerides can very easily unzip into an abundant amount of ketones, and it's because of their special properties about what happens to them once they get into the GI system, and specifically what happens to them within the liver. Let's see here. Okay, so as we look at the first part I like to focus on is what do the bile acids and fat have to do with one another? Bile acids are that green goo that surrounds our fats when we eat fat. If you get real sick, you can often find that those green bile can end up in, people will say, I threw up until I threw up bile. So it's often depicted as green in many of the cartoons. And in fact, bile is what's there to help emulsify fats so that we can digest them, except if they are short chain fats or medium chain fats. They do not require bile acids to be absorbed. So here's a picture of our 3D image of our body, focusing in on the stomach and that first section of your absorption. This green sac is the gallbladder, and many patients or people have written in asking, Doc, I can't do this ketogenic diet because I don't have a gallbladder, or my gallbladder has stones in it. And I've multiple times answered that question to say, nope, that's just not true. You have a liver that will be making the bile, and specifically when you're talking about rehabilitating maybe a gallbladder that has stones in it, or a gallbladder that's just very irritable whenever you ask it to squeeze and work, we start by having patients lick the spoon. And specifically, they're licking the spoon for short and medium chain triglycerides. So this little cartoon shows you a little bit more about that. So as they swallow the short and medium chain triglycerides, at the bottom of the stomach, they kind of turn into a bolus. And those specific fats that are short and medium chain, that means their length in carbon is shorter, they can slip right past that gallbladder, right past the liver secretions to further a few inches down the GI tract, be absorbed without the help of bile. People think you have to have bile to absorb fat, and indeed most of the fats that we eat, that is the case. But when I am trying to work with a patient who has fat malabsorption or a very leaky gut, or one that any type of fatty foods, and they are in the toilet with almost explosive diarrhea, I'm telling them we have to start with the fats that your body can easily digest, easily absorb, and that's where these small and medium chain triglycerides come in. So to say that you have to have a gallbladder to be on the ketogenic diet is hooey. That's not true. But most importantly, I think it's really valuable for you to see what's the purpose of what that gall or that bile is doing. So here's some of the longer chain fatty acids, and again, they're creating a bolus at the bottom of the stomach. And before that, those long chain triglycerides, which again are most of the fats that we eat, before they can be absorbed, the bile, which is stored in the gallbladder but also made by the liver, needs to surround that fat and emulsify it so that as it travels down that first section of the gut, it can be absorbed. Without bile, those long chain fats end up in the toilet and cause quite a stinky mess. So let's move on to the next differentiation between the short and medium chain triglycerides versus the long ones, and that has to do with your pancreas. Pancreatic enzymes are important for digesting and breaking down foods. Specifically, fats need help with absorption when they are long. But pancreatic enzymes are specifically the lipase is not needed for short and medium chain fats to be absorbed. Again, people with a diseased pancreas can actually have been have suffered from a gallbladder that's not working, or a gallstone that blocked off the drainage for their pancreas. Many times addiction, specifically alcohol addiction, can really ruin a pancreas. But other problems like chemo and trauma can also be, and just chronic poor health can make your pancreatic enzymes so they're not doing their job. And instantly people say, I cannot do the ketogenic diet because I have very poor pancreatic enzymes. And I'm like, that's just not true. Pancreatic enzymes are not required for the short and medium chain triglycerides. And once we get those being absorbed and emulsified and used in the system, we often find that the healing process can begin. So as we look at a pancreatic enzyme, this is my picture of a pancreas, and anatomically it's not in front of the stomach, it's in the back, but stay with me here. So your pancreas is that yellow organ I drew in there, and the purple part is the part that drains the pancreas. As you look at short and medium chain triglycerides, they come on into the stomach just like we showed before. They create a bolus at the bottom of the stomach or at that top part of the intestines. And in order for those to be absorbed, we can take the small and medium chain ones and pass them right past the pancreas, not asking for any extra help from the pancreas. And indeed, those nutrients end up within your circulation. In contrast, when we talk about the long chain triglycerides, again, starting with C12, carbons of 12 lengths or long, we take that food, we turn it into a bolus at the bottom, but if you want those to be absorbed, that pancreatic enzyme needs to break down those longer chain triglycerides in order for them to get through that membrane and be absorbed as nutrients. All right, so we've done quite a few things here. We've looked at the size of those of the different carbons in your short, medium, and long triglycerides. We've looked at bile acids and how your short and medium fats do not require bile acids, as they do not require pancreatic enzymes, whereas your long fatty acids require bile and pancreas. And now we're going to get to another very favorite part of my education, which I've talked about before, and that is what happens inside the portal vein. As nutrients comes through the gut, there is a very unique part of the GI system that allows very, I like to think of it as very important VIP particles into the circulation. And short and medium chain triglycerides are allowed to be absorbed into the portal vein, whereas long triglycerides require digestion. So the blue hose is what I'm representing as your portal vein, and portal vein actually ports nutrients into the liver. That's kind of where it gets its name. Short and medium chain triglycerides again come into our bolus formation, and they are able to absorb directly into that portal vein without any assistance. The best part about that is once those fats get into the liver, they are quickly converted into ketones. And that is why when I'm looking at improving people's metabolism or helping their energy, that we talk about using some of these medium chain triglycerides to really increase that energy conversion by supplementing ketones in a way that is not just from BHB or the exogenous ketone salts. Let's look at those long chain triglycerides, and again, same kind of cartoon coming down to the part of the stomach where the fats need to have some attention. But in this case, if even when we put the gallbladder to work, we put those pancreatic enzymes to work, there is no way that those long chains ever can fit or be absorbed into that portal vein. They need to be digested. So they are uniquely different there. No matter how much of your gallbladder you pour on them or how many pancreatic enzymes, that's going to be the case. This is the part that I haven't talked much about, but I really think is important. When I'm looking at the most ill patients, the sickest patients in an internal medicine clinic, they are often malnourished from a chronic inflammatory problem like Crohn's disease or another autoimmune problem. And as their body leaks nutrients and has just suffered from malnourishment, their mitochondria is what really is the sickest part of them. If I could just pull out a mitochondria from every patient that walks through the door and measure the health of their mitochondria, it would fast forward through the history and the time that they've spent where their body has not healed from an illness or suffered from chronic inflammation. If I could just dial in to see what's happening inside their mitochondria, I could cut to the chase and say, oh, here's how sick the patient is, and here's how long it's going to take for me to help them get better. So as I look at the mitochondria, this thing called carnitine is not required in the short and medium chain triglycerides, but it is required in the long chains. Carnitine is one of those nutrients within our bodies that is abundant in my carnivore patients. But if you're a vegan or stay away from a lot of animal products, the carnitine can be very undersupplied. If on top of that you have an inflammatory process like you're overweight, you're insulin resistant, you have a leaky gut, you have, you know, you have a cancer, so any of those long-term chronic illnesses also can be very depleting. You'll find depleted carnitine in their systems as well. A healthy ketogenic diet, especially high in carnivore, will not be low in carnitine. So here we have a mitochondria. I think this is a beautiful picture of a mitochondria. You can see the outer membrane, and then you can see that really important part on the inside of their mitochondria, which is filled with beautiful lattice work of a wavy membrane, and that is where the magic of life shows up. That's the health versus not the health. If I'm trying to feed energy into a mitochondria, it's like a campfire. It's like the energy, the furnace, the fuel houses of a body. And we can feed them glucose, often represented by these little red squares on my channel. We can feed them ketones. Ketones have a longer energy. Glucose has a quicker energy. But I think it's not as commonly talked about that mitochondria, especially in our muscle cells, get most of their energy from fat. And the types of fat that go into the mitochondria and how they're burned are different based on size. So let's take a closer look at that. We're just going to remind you that I've kind of tweaked this cell so it looks a little more familiar. So you've got the nucleus in the center, and that pink part on the outside is the cytoplasm. And then I just really blew up the mitochondria so you can see them. They're much tinier than this in reality, but it helps for teaching just to blow them up for you. All right, so here's our mitochondria. This pink part outside here is the cytosol, and we're going to start with our short-chain fatty acids. These short-chain fatty acids, especially in a muscle cell, are stored within the cell, and they are part of what your body will use for energy. As you take those short-chain and medium-chain fats, you put them across that outer membrane and inner membrane for the mitochondria, hop it over to the acetyl-CoA, and you turn those strings of energy, those strings of fat into energy by using the Krebs cycle and your electron transport chain and some oxidation and some phosphorylation. I don't care to get into all that today. I do love talking about that and have a couple other videos about that. But what I'm showing you there is short chain and medium chain triglycerides really do have the ability to hop into the right spot so they can be used as energy. However, these are the long chain fatty acids. And when you look at the difference between what happens with them as they attempt to go into the outer membrane and inner membrane, they cannot do that without the help of carnitine. So as I look at the way this plays forward, carnitine is this nutrient, and as long as it's found within your cells, it will come along and lift those long chain fatty acids across that membrane from the outer membrane to the inner membrane of that mitochondria. Your acetyl-CoA will then do what it's supposed to do, which is turn all that into some energy. Again, the fats, the fatty chains are really an abundant source of energy. So having a limitation on whether or not you can use them based on a carnitine nutrients is something I don't hear much of the keto educators talking about much, but it is very important. So I think the final part is to compare how much energy do you get from short, medium, and long chain. And I think this makes logical sense that for the grams, the kilocalories per gram of fat, the short and medium chains are actually you get less energy out of the short and medium chains as opposed to the long chains. Now, you can look at that in a couple of ways. Long chains are going to have more return, more energy that you get. So you can make more energy from it. You can supply more ATP from it. But it also is that when you are consuming those fats, they are less energy units that are burned when you're if you're looking at a ketogenic diet long term. So here's just the depiction of how that looks like in cartoon form. So here's your short chains. They hop right over that membrane, get into the Krebs cycle, and spin their electrons all the way down the transport chain, and out for energy is 6.8 kilocalories per gram. And again, this mitochondria respiration stuff is fun for me to talk about, but most people don't care, so I'll skip over it. When it comes to the long-chain fatty acids, again, we're going to show you that long-chain fatty acids do require the carnitine. So here's our carnitine. It's going to come over, pick up those long chains, hop them over those membranes. There your acetyl-CoA does what it's supposed to. Your carnitine gets recycled, and then the energy comes out from that electron transport chain and oxidative phosphorylation. With the long chain, we do have 9 kilocalories per gram. So again, kind of a detail and a dorky thing, but I really think it's interesting. So as you look at the punchline of what I'm trying to get across is many times I have patients call in, or in my own clinic, let's see here. In my own clinic, I have people who really struggle with the ketogenic diet, and many times they are the ones who need this the most. They have indeed suffered the greatest from chronic inflammation, chronic malnourishment. And for all of my patients, the goal is to get them off of medications, to not have any supplements. But I have found that, first of all, I don't put my name on supplements that I don't use in my own clinic or my own home. And I think the MCT MCT standing for medium chain triglycerides, but these are some soft gels that I've just found very useful in my clinic. And this is where lick the spoon comes back full circle. So when we look at those patients who are malnourished, who have chronic inflammation, or who have had gastric bypass and their gut just will not absorb those fats, 2 or 3 bites of a ketogenic diet and they are in the toilet saying, "Doc, I'm never trying that again." And like I said, they're often the ones who really need the healing the most. So I will tell them to lick the spoon. What does that mean? It means the C8, C10 that are found in medium chain triglycerides can be bought in liquid form, but you can also buy them in soft gels, and I've just found the soft gels are easier for my patients to stay compliant with. But they will, they'll put a bunch of it in their coffee saying, they tell me this medium chain triglyceride stuff is going to solve all my problems. I'm going to start supplementing with it. 1 swig, and about 15 minutes later, they're in the toilet with explosive diarrhea saying, "Doc, that wasn't any different than the other fats that I've been taking." So I tell them, lick the spoon. So I'll tell them to take one of these soft gels and then bite it. And the oil comes out, and you can kind of see it's just an empty capsule now. And it doesn't have really any taste at all. But what that capsule does is, I have some patients who are so sensitive, their gut is so ill, it's so swollen, that even that little bitty squirt of oil from that soft gel will cause some diarrhea at first. And I tell them, stay at 1 capsule until you can tolerate it, and then go to 2 capsules, and then go to 3 capsules. And what you're trying to do is get up to about 4 tablespoons of that oil, or about 16 capsules, soft gels a day. And what you've done during that time is you've hacked the process of getting your gut to absorb fat again. Again, this is a process that you can get there. Many times when they come in and they haven't reaped any of the benefits of a ketogenic diet, they're low on energy, they don't feel well, and then every ounce of food I offer them to eat is causing them terrible symptoms. So I will say, we're going to start you on a ketogenic diet. We're going to try and get those carbs to less than 20 total carbs per day, and we are going to use this fat. We are going to use MCT. When they put that in at first, we gently start raising the amount of fat to the place they can tolerate it. But I want you to remember back to the mitochondria. Their mitochondria have been low on energy. They've been using glucose as energy, and it is a tragedy that most of that energy they are pushing through their mitochondria flares up and down and does not give them the improvements of feeling better. So I've found that about the time they can tolerate about 6 of these little soft gels at a time is when their mitochondria get out of the rusty phase and they really do start to feel better. As I said earlier, it's not something I want my patients on forever. I do want them healing, and if they've been sick for a long period of time, they can't just hop over and start having a ketogenic diet without some horrific symptoms. In those cases, this is what I use to bridge them to a better option, and it can take a couple years before I get them off the MCT, but again, the goal is that they shouldn't need supplements, they shouldn't need vitamins, they should be able to eat a nourishing diet that doesn't have all that in it, but sometimes they come to me so sick that the scales are way tipped the other way, and this is how I work around that. All right, I hope you've enjoyed these slides. You can find a link to that MCT that is part of my product brand. It's found on Amazon, but you can find a link below. I'm signing off. Thanks for tuning in. Dr. Boz. See you at the next video.